Hello, good afternoon, good evening, good morning, and welcome. It's Nurse Richard, the Wax Wizard. Thank you for joining me. There are 4 ears in this compilation today. The first two just fairly straightforward, routine, but satisfying nonetheless. And the last two, so staying tuned for those, really interesting ears, and both perforated, so a double perforation. Which this lady suspected but didn't know about. It has a very long history of problems with her ears, but we'll get onto that after these 2 ears. And they were fairly straightforward from what I recall. It looks like I've got a small-ish tube there. You know, you always use a smallish one if there's a fair amount of skin involved. Reduces the risk of clarinetting, which is a horrible little squeal. Sometimes unavoidable, but you shouldn't do it for too long if you start hearing that squealing. And it's when the skin starts flapping around in the tube. I know a lot of you regulars will know all this. But there may be some new followers to the channel. And if that's you, welcome aboard. Where have you been? And before I forget, subscriber of the day today is Stefan Schaefer. Now, Stefan left me an interesting message, and it did make me think. Because the message he sent me was, so I noticed that all your subscribers of the day are female. And that's not by choice. It just, I randomly pick, when I'm making a video, I randomly pick usually the most recent one in the comments. And they're usually always left by ladies because the majority of people who watch what I do are ladies. Now, why is that? It's always baffled me, this. I have no idea. If you know, then please let me know, ladies or fellas, because I ain't got the foggiest why that is. I don't know why it is, why ladies are more inclined to watch this kind of thing. I really don't know. But when I look at the stats on it, something like 80-85% of people who watch are ladies. Now, I suspect that's more to do with the procedure itself than me. I very much doubt it's to do with me. But if it is, thanks, ladies. But yeah, we do have a few fellas watching. And you're one of them, Stefan, so congratulations. You are probably the first subscriber of the day who is a chap. So congratulations. Now, there's a little spot left in here. You will notice a couple of little hairs left in here. They weren't bothering him at all. It's not significant. No need to risk any injuries trying to get them out. I think they just shed hairs from either clipping or shaving. But there's absolutely no need to get them out. I just advise him if he puts a little bit of oil in there, put a couple of squirts of olive oil in, then tip your head out, they'll probably fall out with the oil. But I know that they're not significant. And I'm not interested in peeling that as well, because you get to a certain point in anyone's ear where the skin is not dyed yet, basically. It's not shed and it's not dead. So if it tears off, it usually means it's dead. If it's been a bit more difficult, it usually means it's more attached, so it's not dead yet. So that's why you don't always peel all the way down. Now, this is the lady in question that I was telling you about, who came to see me and was extremely nervous, it would be fair to say, and I don't think she'd mind me saying that. And she'd been putting off coming seeing somebody for ages. But I'd been struggling with the hearing. Now, this was why, but obviously there's a bigger reason why she was struggling with the hearing. And she told me she suspected she had perforations. But a doctor wanted it confirming before they refer her. And that's the reason why, A, I haven't put oil in this ear, because if there's a perforation, you shouldn't. And B, I'm not using any tools because I need to be able to see where my instruments are. Because if you suspect there's something more serious than most in an ear, I wouldn't like putting a tool in there and then behind it, not knowing what's behind it, because you never know what you can find. Because she did describe having surgeries as well, and the reason why she had so many surgeries is I believe she had. So many, in fact, these were all as a child, by the way, and into her 20s, I think. And that was a good 30, 40 years ago, if I can remember her age roughly. So yeah, lots of problems as a child, repeated infections. I believe she also got mastoiditis, which is an infection of the mastoid bone, which is that bone just behind your ear there. Now, she didn't have a mastoidectomy that affected the wall of the ear canal. They just had a little piece removed, the bit that was infected, because I could see the scar behind her ear, but they didn't need to go into the ear canal as well, so there's not a cavity. So they don't always make a cavity when you have a mastoidectomy. You can just remove that piece of infected bone and not go into the ear canal, which is the surgeon's choice, and it depends what they suspect they're looking for as well. So out that little chunk comes, and you will be able to see when the tube comes in anyway and reduces the humidity. I think there's one little bit to remove first. I didn't remove all the little peripheral bits around the edges because, like I said, she was very nervous and there was no need, and the whole purpose of this was to restore a bit of hearing and find out what the problem is. And you can see there what the problem is. There's a huge perforation in this lady's ear. It also doesn't look very happy. It's quite pinky red and inflamed. Quite a fair amount of scarring as well. Another perforation in the second ear, not as big as this one. Now she's always been told not to put drops in it, not to get any water in it. And I think she really, when I asked her if she'd consider any surgery, she said absolutely she would, yeah. Because she's fed up of having to be so careful with it. It might restore some hearing, it might not. But I have referred her to the ear, nose and throat department, and hopefully they consider a surgical repair of that, which usually involves a graft and reconstructing the eardrum there. So I'll keep you posted. They don't often let me know, but I do know a few of the ENT doctors now. I've met some of them, so I'm hoping we can get a bit more follow-ups in some of the patients, which would be lovely. So this is the second ear, and again, fair bit of skin involved in this. Now this was a bit trickier to get out of the entrance. It was a bit more stuck, so I think I had to get some tools out. I think I had to get the curette out. Not yet, but soon. I had to get the curette out to pull this out, because it just got a little bit trapped. Bit of a narrow entrance, this, and it's a bit of an awkward shape. So in a minute, I'm just going to get the curette out and scoop it out, and again you'll see another perforation here, which we think she must have had for a long time indeed, because she doesn't remember having anything done in the last 20-30 years, like I said before. So more than likely it's a chronic perforation, and usually most perforations heal. Obviously the smaller they are, the more likely they are to heal quicker. They usually heal themselves, they usually just literally grow over. Sometimes if they've not healed within like 6, 8, 12 weeks, chances are they usually don't. And obviously that's certainly the case with this lady. So as you can see, I'm just getting a curette in there. And again, there will be a few little bits and bats left in this ear. And that's all because we've removed what we need to remove. And if the patient's nervous, you shouldn't subject them to any unnecessary risk. You know, she was a little jumpy, understandably, and that's why she'd put off having this done for so long. Just having trouble digging the hook in that. It's often the trickiest bit, actually. Once it's out of the ear and it's sitting in the bottom of your ear there, it's really fiddly to get hold of them sometimes. I'm just going to scoop out the last bit there, and you will see the perforation in this one. So don't forget, if you have enjoyed this video, please feel free to let me know in the comments. And I would really appreciate if you could subscribe to the channel. I am on a mission to get to 100,000 subscribers as soon as possible, maybe before Christmas this year. This is if you're watching it in the right year that I've made it. You might be watching this in 10 years, and hopefully I'd have already done it by then. But I'm hoping it can be a little Christmas present to myself. So you can see small perforation in there. So please subscribe to the channel, And if you love what we do, then you can even consider becoming a member, and you get bucket loads of content there, more than you can shake a stick at. Anyway, hope you enjoyed that. But for now, take care of yourself, and I'll see you soon. Ta-da.